This is going to be a step-up progression for people that have issues with the stairs. The key as we progress from lower to higher heights is that you have to do it slow and controlled. It's really easy to just use momentum to work around weakness and think that you've effectively been able to go up and down a step now. So you're going to see that I'd much rather you stay small and do it slowly versus going to that full step and having to use momentum to propel yourself up. So it's typical that patients that I see that want to go up the stairs early on, they really spring up through that lower range, and they'll even kind of hyperextend their knee to get up there, which is obviously not a great way to do it. So before we go to this higher step, I'm going to use something lower, right? This could be a book at home. And it's nice if you have at least one railing to hold on to. Now you'll see that it's pretty small steps, so my knee is just going to have a slight bend in it, right? And I really want to think about keeping a little tension in my stomach and driving through my heel as I come slowly up onto this step and slowly back. A couple key points is that my kneecap really doesn't move. It doesn't move forward, and I also don't snap it backward. Everything is my thigh advancing forward over top of my toes and my heel. I have help if I need it, so I could use my back toe to help initiate this movement if my leg is too weak to do it in a slow, controlled manner. I also have my hands here to help me. So you should have enough around you to be able to do this slowly. I'm really thinking about driving through my heel and bringing myself straight up to where that knee is, pretty much all the way straight, and then back slow. I would rather see someone do 3 to 5, very slow and controlled like this, versus the typical of that. Right? I'm not really getting anything out of a quick movement like that. So once you could do 10 to 20 in that slow controlled manner, then you want to try and take that book and put it up next to the stair, and you try the same thing. This will be a little bit higher, but same idea. You know, if you have 2 hands, you can use 2 hands, but it's that press through my heel, slowly my thigh comes up forward over top of my foot, and then slowly it goes back down. Once again, drive through the heel, use my back toe if I need to help me out a little bit, and back down slow. And then once you're able to do that 10 to 20 times, then you can try and do the same thing with the normal step, right? But don't rush to that normal step and start propelling up. It's the same light tension in my stomach to avoid my back snapping back like that, and everything is my hip advancing forward over top of my knee. Once again, it's not this, all right? It's this thigh advancing forward as I drive through my heel and squeeze my butt.